Hi, how are you doing today? I'm doing very well. So today we are going to talk about why do I wake up with a headache? Alright, so every day I'm going to choose a different article for us to talk about. And the way I choose it is the things that I find interesting or something that is happening to myself. So this morning I woke up with a massive headache. I did not know why. So I was Googling articles to diagnose myself, and I came across this article. All right. So why do I wake up with a headache? Question mark. If you wake up in the morning with a pounding headache, you're not alone. Morning headaches, or at any time of the day, are something millions of people fight with every day. It could be a type of migraine. It could be something else. Okay, all right, so here it says pounding headache. Pounding headache. A pounding headache is a headache that hurts a lot. Okay, so not just any other good old headache, it's a pounding headache. So really, that's what I had this morning. I woke up this morning and feeling, just feel like I've been punched in the face. I had a pounding headache this morning. Okay, so here they're saying that your headache my headache actually can be a type of migraine. Migraine, okay, migraine is another word for headache. Okay, so the difference between headaches and migraines is that migraines is a serious continuous pain in the head, and often with vomiting and difficulty in seeing, okay, according to Cambridge Dictionary. So it sounds like migraines are much more serious. Okay, all right, let's continue. So here's a look at some common causes of morning headaches. Okay, so here it says hangovers. Hangovers. So if you don't know what hangovers are the headaches that you get the morning after a big night of drinking. Okay, when I say drinking, it means drinking alcohol. If you've ever had a little too much to drink, as research suggests, many adults have, chances are you've awakened to a headache as part of a hangover. So like I said, it says here that if you had too much to drink alcohol, so the next day you will wake up with a headache. After a night on the town, when your blood alcohol content drops back to normal or close to it, you start to feel symptoms that can include headaches. Okay, so the expression here is a night on the town. A night on the town means that you went out to party, you went out to have a good time. So here they're saying that when the blood alcohol in your body has dissipated, means gone away, dissipated, you're going to start to feel the symptoms of the hangover, which is a headache. You're going to feel the onset of the hangover. They can be caused by a couple of things. When you drink, the alcohol causes your body to make more urine. So urine means pee, urine, which can cause you to become dehydrated. So dehydrated means you don't have enough water in your body. Dehydrated. The alcohol also causes your body vessels to expand, which can lead to headaches. Oh, I had no idea. So, along with a headache, you may also have tired feeling, heavy thirst. Okay, it means you're very thirsty. Dry mouth, poor sleep, dizziness, a shaky feeling, trouble concentrating, moodiness, means you're moody, happy, sad. Rapid heartbeat. Okay, so that's a quick heartbeat, means your heart is beating very quickly. If you have more severe symptoms like confusion, seizures, slow breathing, or loss of consciousness, get medical help right away. Okay, that sounds very serious. So, fortunately, I don't have any of those symptoms. I just had a pounding headache. That's it. And actually, I am a coffee drinker. If you don't know, after I had a couple cups of coffee, my headache went away. So I really think it's because I am so addicted to caffeine that by the time I wake up in the morning, I need another kick. I need another hit of caffeine there. That is not a good sign. But anyways, so all right, let's continue. Migraine. So, migraine headaches affect more than 10% of people worldwide. Along with head pain, your headache may be a migraine if your vision is affected. Your vision, so meaning your eyes, if you can see or if your vision is blurry, that is vision. You become sensitive to smells, light, or sounds. I mean, who isn't? I am always sensitive to everything. Okay. You feel sick or nauseous. Okay. So feel sick. When you feel sick means you want to vomit, and when you feel nauseous it also means you feel like vomiting. Okay. Your symptoms last anywhere from 4 to 72 hours, but you don't have any. You don't have any between attacks. Okay, all right. I don't think I have that. All right, so the most common time for a migraine to happen is the early morning, as pain medication you took before you went to bed begins to wear off. Oh, okay, I see. So wear off means it's slowly gone. That's what they're saying. They're saying that. So, for example, say the night before you took a pill, you took a painkiller, and it is working while you're sleeping, and by the time you wake up the effects of the medication wear off means it's gone. Okay, wear off. But migraines are complicated, they're different for everybody. Some people have aura. So aura, they are light flashes, lines in your vision, and other visual disturbances before, during, or after their headache pain. Okay, all right, so I don't have auras, thank God. Women are 3 times more likely to have a migraine. That's not fair. So, okay, all right, so we have to bear childbirth and we have 3 times likeliness to have a migraine. Okay, about 13 million American women have migraine attacks when they're menstruating. Oh, okay, all right. So it is more severe when you are on your period. Morning headaches can be other tension headaches too. They're often associated with depression. Okay, here's the word depression again. It comes up in a lot of articles these days. If you have a migraine or headache of any type that continually wakes up in the morning and gets in the way of your work or personal life, a doctor's visit may be in order. Okay, so they're saying that if you have headaches all the time, almost every morning, and it's affecting you personally or at work, then a doctor's visit may be in order. May be in order means you should go see a doctor. That's what they're saying. Treatments, including over-the-counter and prescription medication, are available. Okay, so they're saying over the counter. So over the counter medications means medications that you don't need to go see a doctor for. You don't need a prescription. So you just go to a pharmacy and then you just ask them for the drug. So those are called over the counter medicine. However, here it says prescription medication. So prescription medication, They are the medications that you can only get if you have a doctor's note or a doctor's prescription. Okay, so there you go, that's the difference. Over-the-counter medication versus prescription medication. Okay, next, sleep apnea. Oh, okay, so we were just talking about sleep apnea yesterday. So this is a condition where your throat muscles partially collapse while you sleep and interrupt your breathing. Okay, so they're saying that your throat muscles partially means only parts, only some of it, not 100%. So partially collapse means like come down, okay, fall down or come down, okay, while you sleep. And interrupt means stop your breathing. Okay, so other signs of sleep apnea include dry mouth, snoring, pauses in breathing during sleep, which often cause you to wake up suddenly. Okay, so that would be hard to catch because you're sleeping, so you wouldn't know if you are not breathing or not, I guess. Moodiness. Okay, so see, that one's another hard one to measure because moodiness. Who isn't moody? I am moody all the time. Okay, let's move on. Waking up to pee often during the night. See, that's, some people also do that. It's quite normal. And snoring. So, talk to your doctor about your sleep habits. They may suggest a sleep test, a continuous positive airway pressure, CPAP machine may help, and lifestyle changes like losing weight and rolling off your back while you sleep could also help you get better rest. Okay, so it says here rolling off your back. Rolling off your back. What the hell does that mean? Rolling off your back. Oh, okay. I think it means don't sleep on your back. So that means you can sleep on your side or I guess sleep on your stomach. Okay. So other sleep disorders. The relationship between sleep and headaches is a tricky one. Sometimes headaches are the cause of poor sleep. Sometimes they're the result of it. Okay, so they're saying that it's hard to find a relationship between sleep and headaches. They are not sure what caused what. Okay, if it's hard to get to sleep, stay asleep, or if you just wake up too early, you may have insomnia. Okay, all right, insomnia. I don't think I have insomnia because as soon as I hit the pillow, I am out. I am out cold. Okay, so it's been tied to some forms of chronic headaches. Here's the word again, chronic. So when you say chronic, it means it is a condition that you've had for a long time and you keep having it, sometimes for months and sometimes for years. So that's chronic. So if you say chronic headaches, means that these are headaches that you've had for a long time. Okay, so for example, you can also say chronic headaches, chronic backaches, chronic pain, chronic something. Circadian rhythm. Sleep disorders mess with when you fall to sleep or wake up. They can lead to morning headaches too. Okay, so here's a word that a lot of people talk about, circadian rhythm. So when you say circadian rhythm, you are talking about your personal body clock. That's what they're talking about. So circadian means clock. Circadian rhythm, your body clock. You may be one of the 70 million Americans with a sleep disorder if you have regular headaches when you wake up. Oh my. So I am not American, but I am sure happy to know that I am not alone in this situation. I do often wake up with a headache, and a bad one too. Alright, so if you are sleeping during the daytime, no, I don't take naps. Alright, find yourself depressed often, not really. Have trouble concentrating only after a big meal. I can barely focus after a big meal. I think it's because all my energy has gone to my stomach to digest food. Okay, and forget things a lot. Okay, so who doesn't? Okay, all right. So if you may have a sleep disorder, see a doctor. Okay, next, over medication. So a medication overuse headache can happen if you're already prone to headaches and you take a lot of pain meds. Okay, so pain meds means pain medication. So usually you're talking about Tylenol or ibuprofen, the medication for your pain. Those are called pain meds. Okay, and it says here medication overuse. Overuse, literally, it means you're using too much or using too often. That's what it means. So a MOH, okay, MOH, medication overuse headache, usually hits right when you wake up. Okay, so that is not my problem. I don't do drugs, and I rarely take any pain meds. Very, very rarely. Okay, so a MOH can be helped along by too much caffeine. Ooh, that I am guilty of. I do drink a lot of coffee. So for those with chronic headaches, using medication more than 2 or 3 days a week may be too much. That's not quite as much as often that I was thinking, 2 to 3 days a week. Okay, so check with your doctor about this. They can help you treat your headaches without overusing pain meds. All right, so next one. Okay, so this is a hard word to pronounce. Okay, so all right, let me try. So the temporomandibular, okay, temporomandibular joint, TMJ. So if I probably butchered this word, but don't worry about it. So TMJ connects your jaw to your skull. Okay, connects your jaw to your skull. Pain in the joint and its surrounding muscles caused by things like too much gum chewing or clenching and grinding your teeth at night can bring a morning headache. Okay, I see. So they're saying that sometimes if you're using your jaw muscles too much, like for example chewing gum, okay, or clenching. Clenching means you are tightening. Okay, that's what it means. You tighten your jaw. Or grinding your teeth. Grinding your teeth is when you you are moving your top and bottom teeth from left to right, left to right, left to right. You know, when you're chewing something, you know, like you're grinding your teeth like this. I don't know if you can hear me. Or like this. Okay, that's grinding your teeth at night. So they're saying that if you're doing, if you have a habit like that, then that could bring on a morning headache. Okay, so a dentist can prescribe an oral device. Oral means mouth. Okay, mouth oral device to keep you from grinding your teeth at night. So you should see a doctor if you have a clicking in the joint. Okay, so here they're talking about your jaw. Okay, the joint that's connecting your jaw to your skull. Okay, if you have a clicking, like for example, if you open your mouth, sometimes there's like a click. Okay, that you hear on the side of your cheek. Okay, it's tender or swollen. Okay, so swollen means inflamed. It's red and it's big. Okay, that is swollen, inflamed. Tender means it hurts. Okay, that's what it means. It hurts a little bit. So for example, if I say, oh, I broke my finger and my finger is very tender. Tender means my finger is hurting. It hurts a little bit. That's what it means. Okay, it locks up once in a while. Locks up once in a while. Here they're still talking. I think they're still talking about your jaw. Okay, locks up. Locks up means you can't really move it. It's locked. You can't move your jaw. The pain spreads to your head or your neck. Okay, so they're saying that if your head, if your jaw is hurting and I'm guessing, okay, that your pain is also going to your head and it's going to your neck. Basically, a all around upper body pain. Okay. All right. Next. So next one is tumor. All right. So tumor. When you say tumor, usually you're talking about cancer. Okay. So tumor is like the tumor is a mass, a big growth that is growing in your body, and we're usually talking about cancer. Okay, so anyone who's ever had a severe headache has wondered if it's a tumor. Probably not. It says here only 5 people in 100,000 people are diagnosed with a primary brain tumor each year. So your chances are pretty low of getting a brain tumor. And most of those start somewhere other than the brain. Okay, so they're saying that usually it started somewhere else in your body other than your brain. The chances are much greater that your headache is just a headache. Oh, thank God. All right, so doctors look for a few telltale signs of a brain tumor. Okay, so a sign is a sign. Okay, telltale signs. Telltale signs means it's a clue that's telling you, it's a hint that's telling you that it is brain tumor. Those are telltale signs. Okay, so including depression, again, depression that comes up all the time, trouble staying focused, nausea or vomiting, personality changes, problems with speech or language, seizures, severe, persistent, or changing headaches, vision problems or swelling around your eye, weakness or paralysis. That's a whole list of things. Okay, so if you have any of those, see a doctor right away. Thank God I do not have any of those conditions because it sounds quite serious.